Hello everyone and welcome to today's podcast. In this episode, we'll be discussing the medical situation in Chimborazo, a province in Ecuador that faces unique challenges in healthcare. Chimborazo is a region with a large rural population, which often means that access to healthcare is limited for many residents. One of the key issues is the geographical barriers. Many communities are located in remote areas, high in the Andes, making it difficult to reach medical centers. This isolation impacts not only the availability of services but also the ability to transport patients during emergencies. Another critical challenge is the lack of medical personnel. There's a significant shortage of doctors, nurses, and specialists, especially in rural areas. Many healthcare professionals prefer to work in larger cities where the infrastructure and resources are better, leaving rural clinics understaffed. This in turn puts immense pressure on the few healthcare workers who do serve these communities. Moreover, the province faces high rates of chronic malnutrition, particularly among children. According to recent statistics, Chimborazo has one of the highest rates of stunting in Ecuador. This is a reflection of broader socioeconomic issues such as poverty and limited access to education about proper nutrition. The situation is further complicated by the prevalence of respiratory illnesses, which are common due to the cool climate and poor housing conditions in many areas. Efforts are being made to improve the situation, such as government programs aimed at reducing malnutrition and expanding healthcare coverage. Mobile health hunts have also been introduced to reach isolated communities. However, the reality is that much more needs to be done. Addressing these issues requires not only better funding but also a collaborative approach involving local governments, healthcare providers, and international organizations.
Thank you for that insightful overview. I'd like to expand on some of those points and highlight additional aspects of Chimborazo's healthcare challenges. One of the most pressing issues is the lack of adequate medical infrastructure. While there are hospitals and clinics in urban areas like Riobamba, smaller communities often rely on health posts that are poorly equipped. For example, some facilities lack basic diagnostic tools or sufficient medication to treat common conditions. This means that many patients have to travel long distance to access proper care, which is not always feasible, especially for low-income families. Another significant factor is the cultural and linguistic barriers that exist between healthcare providers and the indigenous population. Chimborazo is home to a large Quechua-speaking community, and many residents prefer traditional medicine over conventional healthcare due to mistrust or miscommunication with the doctors. This highlights the need for culturally sensitive healthcare service that integrate traditional practice and involve community leaders in the health education process. Mental health is another area that deserves more attention. Like in many parts of the world, mental health issues in Chimborazo are often stigmatized and there's a severe lack of resources for a diagnosis and treatment. For instance, there are very few psychologists and counselors available, and those who need help are often reluctant to seek it. Programs focused on mental health awareness and training more professionals in this field could make a huge difference. Lastly, we can ignore the impact of the COVID-19 pandemic, which exposed to the vulnerabilities of Chimborazo's healthcare system. During the height of the pandemic, hospitals were overwhelmed and many rural communities were left without proper testing or vaccination campaigns. While the situation has improved, it has also highlighted the need for long-term investments in healthcare infrastructure and preparedness for future crises. Chimborazo is a province full of potential, but addressing these healthcare challenges is essential for its growth and the well-being of its people. Thank you both for this in the perspective, and clearly there's a lot to unpack when it comes to the medical situation in Chimborazo, and it's a topic that deserves continued attention. Stay tuned as we discuss potential solutions and hear from experts in the field in the next segment.